Imagine this. You or a loved one are faithfully taking your daily medications, doing everything right, yet your memory is slipping, names are harder to recall, and confusion creeps in more often. You're not alone. In fact, studies show that over 70% of seniors in the US take at least one prescription medication daily, and nearly 40% take 5 or more. But here's the terrifying truth. Some of these medications may not be helping at all. Instead, they might be silently accelerating cognitive decline, leading you down a path toward rapid dementia. Shocking new research has found that 9 commonly prescribed drugs, yes, the ones in your medicine cabinet right now, may increase your risk of dementia by as much as 54%. These aren't obscure drugs with rare side effects. We're talking about popular antihistamines, sleep aids, anxiety medications, cholesterol-lowering pills, and more, many of which are marketed as safe and effective, especially for older adults. The worst part? These drugs don't just impact your memory slowly over time. For some people, the effects can be noticeable in just months. Increased forgetfulness, difficulty concentrating, brain fog, and even mood changes. And if you're taking more than one of these medications at once, which many seniors do, your risk multiplies. Think about it. Could the very medications meant to help you be silently harming the most critical organ you have, your brain? So we want to hear from you. Are you, or someone you care about, taking any of the medications on this list? Have you noticed any changes in memory or focus? Drop a comment below and share your story. It might help someone else recognize the warning signs before it's too late. And before we dive into this essential list, do us a favor. Like this video and subscribe to our channel for more life-saving health insights just like this. Your support helps us reach more people who need this information. Now let's get into the 9 common medications that may be silently accelerating dementia. Number 9 is antihistamines. Antihistamines like diphenhydramine found in Benadryl are used by many people to treat allergies or help with sleep. But here's the catch. These older types of antihistamines block a brain chemical called acetylcholine, something your brain needs to keep memory and learning sharp. Acetylcholine acts like a messenger in your brain. It helps your brain cells communicate clearly, especially when it comes to memory, focus, and attention. When you block this chemical, it's like cutting the wires between brain cells. Messages don't get through as well. That's why you might feel groggy, confused, or forgetful after taking one of these medications. When this chemical is blocked repeatedly over time, it can lead to foggy thinking, memory loss, and even structural changes in the brain, like shrinkage. One large study found that people who used strong antihistamines regularly for just 3 years had a 54% higher risk of developing dementia. These drugs are part of a group called anticholinergics. And here's the thing, many people take more than one anticholinergic medication without realizing it. You might take an antihistamine to help with sleep, and also take a bladder control medication or a cold remedy that has similar properties. All of these can add up and increase your risk. The problem is that because these medications are sold over the counter, people assume they're completely safe. They're marketed as harmless sleep aids or allergy pills. But for older adults, they can do more harm than good, especially if used frequently or for long periods. You might start by just feeling a bit forgetful or groggy in the morning after taking a nighttime antihistamine. But over time, those small changes can grow into serious memory problems that affect your daily life. If you or a loved one is using antihistamines regularly, especially as a sleep aid, it's worth talking to your doctor or pharmacist. There may be safer alternatives that don't interfere with your brain function. Number 8 is benzodiazepines. Benzodiazepines, like Valium, Ativan, and Xanax, are often prescribed to treat anxiety, insomnia, and muscle spasms. These medications work by slowing down activity in the brain, which helps you feel calm or sleepy. They act on a brain chemical called GABA, which has a calming effect. This can be helpful if you're dealing with high stress, panic attacks, or trouble sleeping. But when used for too long, especially in older adults, these drugs can become a serious risk to brain health. That's because benzodiazepines can accumulate in your body, especially as your metabolism slows with age. Over time, this buildup makes your brain function slower. You might feel more drowsy during the day, have trouble concentrating, or begin to forget important things. A major study published in the medical journal BMJ found that taking benzodiazepines for more than 3 months was linked to a 51% higher risk of Alzheimer's disease. And this wasn't just in people with severe health issues. It affected regular seniors using these drugs for sleep or anxiety. Another concern is that benzodiazepines can increase the risk of falls and accidents. If you feel unsteady, dizzy, or groggy, especially when waking up at night or getting out of bed, these drugs may be playing a role. Falls in older adults can lead to broken bones, hospital stays, and long recovery times. The symptoms caused by these medications can be subtle. You might chalk them up to normal aging, like forgetting appointments, feeling fuzzy-headed, or having trouble following conversations. But in many cases, they're side effects of long-term benzodiazepine use. If you've been taking a benzo for sleep or anxiety for several months or years, don't stop suddenly, but do talk to your doctor. There may be safer treatments available, including therapy, lifestyle changes, or newer medications that don't carry the same risks. Number 7 is proton pump inhibitors. Proton pump inhibitors, such as omeprazole, Prilosec, and pantoprazole, Protonix, are used to treat acid reflux or heartburn by reducing stomach acid. That sounds like a good thing. After all, nobody wants to suffer from chronic heartburn. But here's what many seniors don't realize. Your stomach acid plays a crucial role in helping your body absorb nutrients, especially ones your brain needs to stay sharp. When you take proton pump inhibitors regularly, your body may absorb less vitamin B12 and magnesium, 2 nutrients essential for healthy brain function. Without enough of them, your brain might not work as well. You may start to feel more tired, confused, or forgetful. Over time, these deficiencies can contribute to long-term cognitive decline. In fact, a large German study found that seniors who used proton pump inhibitors regularly had a 44% higher chance of developing dementia than those who didn't. And this risk increases the longer you take the medication. Another problem is that proton pump inhibitors are often taken for years, even though they're usually intended for short-term use. Some people start them for heartburn and just keep refilling the prescription, assuming it's safe to stay on it forever. But the longer you use it, the more your nutrient levels can drop. If you've been on a proton pump inhibitors for more than a few months, talk to your doctor. There may be other ways to manage heartburn, like dietary changes, losing weight, avoiding trigger foods, or taking the medication only as needed. Keeping your brain healthy means thinking about the big picture, including what you eat, how you sleep, and yes, even how you manage your stomach issues. Everything in the body is connected, and sometimes the pill that fixes one thing might quietly harm another. Number 6 is antipsychotics. Antipsychotics, such as risperidone, Risperdal, and quetiapine, Seroquel, are powerful medications often used to help control symptoms like aggression, severe anxiety, or hallucinations in people with dementia, schizophrenia, or bipolar disorder. At first, these medications might seem like a blessing. They can help someone feel calmer or less agitated, but there's a big downside, especially for seniors. These drugs work by altering the levels of certain brain chemicals, including dopamine and serotonin. While these changes might help with mood or behavior, they can also dull overall brain function. Over time, people on antipsychotics might seem emotionally flat. They may have a hard time expressing themselves or reacting to situations. Their memory and focus can get worse. Some people become more withdrawn, stop enjoying activities they used to love, or even lose the ability to care for themselves. What's even more concerning is that the U.S. Food and Drug Administration, FDA, has issued a black box warning, the most serious kind of warning, about using antipsychotics in elderly patients with dementia. The reason? These drugs significantly increase the risk of stroke and even death. Despite this, antipsychotics are still commonly prescribed to seniors, especially those in nursing homes or assisted living centers. Sometimes it's because they seem to help with behavior problems, but in many cases, the risks outweigh the benefits. If your loved one is on an antipsychotic, don't panic, but do ask their doctor why it was prescribed and whether there might be safer options. Sometimes adjusting the environment, routine, or using therapy can be just as effective without the same risks. We've now covered 4 medications that may be silently sabotaging your brain, especially if you're over the age of 60. From common allergy pills to powerful psychiatric drugs, the risks are more real than most people realize. Have any of these surprised you so far? Are you currently taking or have you taken any of the medications we've discussed? We'd love to hear your experience. Share in the comments below so we can start a conversation and help others become more informed too. And if you haven't already, don't forget to like this video and subscribe to our channel. We have more eye-opening health content coming up, and you won't want to miss it. Number 5 is Z-drugs, sleep aids. Z-drugs, such as zolpidem, Ambien, and ezopacolone, Lunesta, are medications often used to help people fall asleep faster. They are commonly prescribed to seniors who struggle with insomnia. Getting good sleep is important at any age, but especially in your later years. Unfortunately, these drugs may cause more problems than they solve. While they might help you fall asleep, they don't promote deep, restorative sleep, the kind your brain needs to heal and organize memories. Z-drugs work by affecting the brain in ways similar to benzodiazepines. They slow brain activity, making you feel drowsy. But this sedation doesn't mimic natural sleep, and it can interfere with important brain processes like memory consolidation. Many seniors report feeling groggy, confused, or hungover the next day. Some even experience strange behaviors like sleepwalking, sleep driving, or doing things while asleep and not remembering them. Long-term use has been associated with increased risk of dementia, falls, and fractures. A study published in the British Medical Journal found that seniors who regularly took Z-drugs were significantly more likely to develop dementia than those who didn't. This is a serious concern, especially since many older adults take these drugs nightly for months or even years. If you've been relying on a sleep aid, talk to your doctor. There are safer approaches to improving sleep, such as cognitive behavioral therapy for insomnia, CBTI, light exposure, and good sleep hygiene habits like limiting screen time and avoiding caffeine late in the day. Number 4 is tricyclic antidepressants. Tricyclic antidepressants, including medications like amitriptyline and doxepin, were once very common for treating depression, anxiety, and even chronic pain. Today, they're used less often, but they're still prescribed to many seniors. These medications have what's called anticholinergic effects, meaning they block acetylcholine, the same brain chemical that antihistamines and bladder medications interfere with. Acetylcholine is essential for memory and learning. When levels drop too low, cognitive problems can set in. Tricyclics are especially concerning for older adults because the aging brain is more sensitive to these effects. Seniors who take these drugs may experience confusion, blurry vision, dry mouth, constipation, and most importantly, memory problems. One study published in JAMA Internal Medicine found that people who took high doses of anticholinergic drugs for long periods had a significantly increased risk of dementia. The more you take and the longer you take it, the greater the risk becomes. If you're on a tricyclic antidepressant and have noticed that you're forgetting things more often or feeling foggy, don't ignore it. Talk to your doctor. There are newer antidepressants available today that don't have the same impact on brain health and may be a better fit. It's not just about treating depression, it's about doing so in a way that protects your long-term memory and quality of life. Number 3 is bladder control medications. Bladder control medications like oxybutynin, ditropan, tolterodine, Detrol, and sulfonacin, Vesicare, are often prescribed to help manage symptoms of an overactive bladder. These medications can reduce the urge to urinate frequently or help prevent embarrassing accidents, which can be especially frustrating for older adults. However, these medications also come with a hidden cost. They work by blocking acetylcholine, a vital chemical in the brain responsible for memory, learning, and concentration. As we've seen with other drugs in this list, reducing acetylcholine can interfere with brain communication and lead to significant cognitive decline over time. For seniors already experiencing mild forgetfulness, these medications can make the problem worse. You may start having trouble planning tasks, remembering details, or staying focused in conversations. In more serious cases, these symptoms can progress into full-blown dementia-like behavior. A study conducted at the University of California, San Francisco, found that older adults who used bladder medications had smaller brain volumes and scored lower on memory tests than those who did not. In other words, these drugs may not only affect how your brain functions, they could also change its physical structure. And the issue is widespread. Millions of seniors are prescribed these medications, often for years, without knowing the impact on their cognitive health. The challenge is that overactive bladder is a real and disruptive condition, so doctors turn to these drugs out of habit or convenience. If you're on a bladder control medication and have noticed your memory slipping or mental sharpness fading, bring it up with your doctor. There may be other options available, such as pelvic floor therapy, dietary adjustments, or non-anticholinergic treatments that can help without harming your brain. Number 2 is statins. Statins, including atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are commonly prescribed to lower cholesterol and reduce the risk of heart attack or stroke. They're some of the most widely used medications in the world, especially among seniors. But while statins help protect your heart, they might be doing something very different to your brain. That's because cholesterol is not just a villain. It's actually essential for brain health. Your brain contains about 25% of all the cholesterol in your body, and it uses that cholesterol to build and maintain neurons, the brain cells responsible for thinking, memory, and learning. By lowering cholesterol too much, statins may interfere with the production of key neurotransmitters like serotonin and dopamine, both of which are critical for mood regulation and mental clarity. Some users report feeling foggy, distracted, or emotionally flat while on statins. A study in the journal Pharmacotherapy found that 75% of patients who experienced memory issues while taking statins improved after stopping the medication. Another study linked long-term statin use to a higher risk of cognitive impairment in older adults, particularly those with already low cholesterol levels. It's important to understand that statins are not inherently bad. For many people, they are life-saving drugs that can prevent heart attacks and strokes. But like any medication, they need to be used with care, especially if you're experiencing unexpected side effects. If you're noticing memory lapses or mental fog while on a statin, talk to your healthcare provider. You may need a different dose, a different medication, or a reassessment of your cholesterol goals. Always weigh the benefits against the risks, and make sure your brain health is part of the conversation. Number 1 is anticholinergic combinations. Anticholinergic combination drugs are among the most dangerous for brain health because they contain multiple ingredients that block acetylcholine. These drugs are found in common cold and flu remedies, nausea treatments, muscle relaxants, and even some prescription sleep aids. Individually, each drug might not seem harmful, but when taken together, whether on purpose or by accident, their effects can pile up and create a serious problem for your brain. This is known as a cumulative anticholinergic burden. You might be surprised at how easy it is to accumulate this burden. For example, you might take a cold medicine with diphenhydramine, a sleep aid with doxylamine, and a bladder medication, all in one day. Each of these blocks acetylcholine in its own way. Together, they can drastically reduce the brain's ability to function. One of the most important studies on this topic followed over 3,400 seniors for 10 years. The researchers found that those with the highest cumulative use of anticholinergic medications had a 54% higher risk of developing dementia, even if they stopped using the medications years before symptoms appeared. The tricky part is that many seniors and even doctors don't realize these overlapping effects. These medications are often prescribed by different doctors or picked up over the counter, with no warning labels about the cognitive risks. If you're taking more than one medication, prescription or not, ask your pharmacist or doctor to review them. They can help you identify combinations that may be harmful and suggest safer alternatives. Remember, the goal is not to scare you away from all medications. It's to empower you to ask the right questions and protect your brain. Your memory, focus, and independence are worth defending. If you're a senior or caring for one, understanding the hidden risks of these medications is more important than ever. What may seem like a harmless daily pill could actually be chipping away at your memory, your independence, and your quality of life. And the most frightening part? The changes are often so subtle, you may not realize something's wrong until the damage is already done. Let's quickly recap what we covered in this video. We started with antihistamines, often taken for allergies or sleep, which block a brain chemical essential for memory. Then we looked at benzodiazepines, commonly prescribed for anxiety and insomnia, which can dramatically slow brain function over time. We explored proton pump inhibitors used for heartburn that may interfere with your brain by blocking nutrient absorption. Antipsychotics came next, medications that can dull brain activity and increase the risk of stroke in elderly patients. We reviewed Z drugs, sleep aids that disrupt healthy sleep patterns and can lead to confusion and falls. Then we discussed tricyclic antidepressants, older medications that block key brain chemicals tied to thinking and focus. Bladder control drugs followed, effective but potentially harmful for memory and brain size over time. We covered statins, which lower cholesterol but may also interfere with the brain's own needs. And finally, we talked about anticholinergic combination drugs, found in everything from cold medicine to muscle relaxants, that quietly add up and drastically increase dementia risk. You've now taken the time to learn about these 9 categories of medications that could be silently speeding up dementia. That knowledge gives you power. Power to ask better questions, power to talk to your doctor, power to make smarter choices for your health. Now, it's time to take action. Talk to your healthcare provider about every medication you or your loved one is currently taking and ask if any fall under the categories we discussed. Don't stop any medications without medical advice, but do explore safer alternatives and lifestyle changes that might reduce your dependence on risky prescriptions. Start protecting your brain today by eating the right foods, getting quality sleep, staying physically active, and keeping socially connected. We also want to hear from you. Have you or someone you love experienced brain fog, forgetfulness, or memory problems while on any of these medications? Have you switched to alternatives and noticed a difference? Tell us in the comments below. Your story might help someone else avoid the same fate. If this video opened your eyes, give it a like. It helps us reach more people who need this vital information. And don't forget to subscribe to our channel. We're bringing you more videos on natural remedies, brain health, and how to live stronger, longer, and better. And finally, share this video with someone you care about. You never know whose life it might change. Thanks for watching, and we'll see you in the next one.